Hi, and welcome to the first ever episode of The Voice of Healthcare, a new show on the podcast network Voice First FM. My name is Bradley Metrock. I'm CEO of Score Publishing, a company based in Nashville, Tennessee, whose mission is to help people become better interactive content creators. Our sponsors for this show are the Alexa Conference, which is a conference we run, which is the annual gathering of Alexa developers and enthusiasts from across the country and the world. It's coming up in January in Chattanooga, and the keynote speaker for that is Dr. Ahmed Bouzid, the original head of product for Alexa and connected homes for Amazon. And our other sponsor for this episode is Fourthcast, FOURTHCAST.com. It's a software as a service on the internet that will turn your podcast into an Alexa skill. Check it out at fourthcast.com. This show will be every month for about half an hour to an hour and will involve different guests. But for today, it'll be me interviewing my co-host, my friend of many years, Dr. Matt Cybulsky. Matt, say hello.
Hey, Bradley. Hello, everyone out there.
Thanks for joining us, Matt. And the purpose of this show will be to examine the growing intersection between voice-first technology and the healthcare industry. And so let's start out with, Matt, talk to us a little bit about your background and how you sort of got to this point in terms of your education and your experience.
Sure, Bradley. I think like most people, where you end up tends to sometimes be a combination of luck, exposure, and effort and will. I certainly didn't come across using voice-first technology in healthcare as something that I wanted to do a decade ago. I came across mostly voice-first because from training, I'm a behavioral economist. So I'm very much interested in behaviorally informed approaches to solutions in healthcare, opposed to spreadsheet-driven, reviewed approaches to problem solving. I think that when it comes to getting people to modify behaviors, having physicians and surgeons, providers, nurses, whoever, interact more fluidly with tools and technology that's growing at a logarithmic pace in healthcare, we got to have a way to do it that's hands-free, where the data transfer is lossless, and more contextually personalized for humans. As a psychologist, I've been working in quality and safety for some time now. My career in healthcare started out largely in healthcare finance. Moved to get some deeper training in behavioral economics simply because I realized people had a hard time understanding their bills, their invoices, and their insurance reimbursement. So I was lucky enough to be part of an organization, Tenet Healthcare, who had some forward-thinking executives, and upon a conversation with one of them, Steve Mooney of Conifer Health Solutions and Norma Zarang of Conifer Health Solutions, they encouraged me and supported me in the pursuit of getting a PhD, all in the name of modifying invoices, studying consumer behavior, in order that we get them into a situation where they're not as likely to go bankrupt or turn their accounts into bad debt, really hurting their credit score, hurting their ability to get loans, pay off debt, and be healthy. We had some great success together. This turned out to be a way for me to become a professor at a medical school where I was working closely with surgeons and practitioners at UAB School of Medicine on improving quality and safety using mostly spreadsheet-driven, condition-specific protocol to reduce things like length of stay, readmissions, utilizing supplies properly, and reducing error. I knew as a psychologist that there was a lot of benefit from us looking at the same problems of readmission reduction, quality, length of stay, error, utilizing behaviorally informed approaches. But I didn't know until recently that the growth of these voice-first tools would be such rapid advances and ease of use that we could start deploying them in healthcare. And it wasn't until the last year and a half that I got very serious about how we could use something like Alexa, for example, to interact with both providers and patients to make the care that they deliver or the care that they receive more accessible, more transparent, extended their reach, and provide the financial stability that I was looking to help patients and providers with years ago, and do it in such a vivid and unique manner. So yeah, a long story short, I ended up being involved with Alexa and voice first technology. One, because I wanted to make a difference, but two, it was largely accidental and being in the right place at the right time.
Well, you did a great job at the first ever Alexa conference that was this past January in Nashville, and appreciate you joining us for that. And
It was a
let's
total
talk
pleasure, by
about,
the way. I won't miss it again for the following year.
yeah, no, and it was very insightful, and it'll be great to have you back. Share with us about the last week and a half for you, and share with the audience what you spent your time doing presenting to folks who run the Alexa Fund and what the Alexa Fund is, and why you were doing that at Carnegie Mellon.
Yeah, well, first of all, thanks for the kudos from last year. I was luckily invited to come speak about what these voice first technologies could offer medicine and how it could be changed. There are some amazing things going on across the country with voice first. I mean, one of my favorite examples is Boston Children's Hospital uses the Alexa tool for children in the burn and ICU units. And they use it for entertainment, right? To change channels or music, education. What is this disease I have? How do I take care of myself? What are the medications I take and when do I take them? And importantly, communication with staff. In the burn unit especially, having something like an Alexa is wildly, wildly important. It reduces the risk of infection because there's less people that need to interact physically with the patient. But importantly, and also tragically, when these patients, these pediatric burn patients are in the unit, a lot of times they can't move, or they're instructed not to, or they're in a lot of pain. But they can use their voice. And so if you can use your voice and you have an Alexa or a Dot or an Echo Show, the world is yours as long as it's connected appropriately. They've had some really interesting success there. But back to the topic at hand, I wouldn't miss this upcoming conference also, Bradley, because I've been named the lead of the healthcare section, and I'm really happy to do that. And I'm very excited about the speakers we have, as well as the presentations and the networking that's going to be available there. Last year, you could really feel the spark and the spirit in that place. So I'm honored to be leading it on the healthcare side for the following year, of course, with the guidance from Score Publishing. But secondly, your other question, why CMU and what the heck am I doing there? Well, I've been really fortunate to have great mentors along the way. I have part of my personality is really extroverted. If you know me, I don't really meet strangers, and I also get very, very energized by being around people. So anytime I see someone doing something interesting or that has some dynamism or charismatic qualities, I want to know who they are and I want to befriend them. They're fascinating to me. The human creature is fascinating to me, but leaders and mentors are really fascinating to me. And I've had some good ones over the years. Luckily for me, I've got two really good leaders right now that I'm working with. At CMU, there's a fellow named Joe Marks, who leads their innovation center, or one of their innovation centers. He's a very dynamic fellow. He's been involved quite a bit with lots of work in the healthcare space over the years. He works closely with another behavioral economist, and Joe has been really instrumental in opening my eyes to the entrepreneurial world. As such, I've been working closely with a CEO at Signature Healthcare in the Boston area, Signature Healthcare System, Kim Holland. who's a well-known CEO and leader in the American College of Healthcare Executives, and very encouraging of our collaboration together as a behavioral economist. We've partnered together to cover various vectors in his hospital. The reason that I bring up Joe and Kim is because they both have been really encouraging about using voice-first technology in the handling of population health and optimizing care, given the need to do so with a minimal amount of providers and a shrinking amount of providers in comparison to the demands of the modern healthcare consumer. Kim has been open to me using Alexa technology to reduce readmissions, and we're really starting in the space with chronic obstructive pulmonary disease, otherwise known as COPD, the primary cause of which is smoking. And for people over the age of 65 or approaching 60 years old, is a massive problem. It's a $50 billion cost to the United States healthcare system a year. 24 million people in the United States are purported to have this disease. Only about half of them have been diagnosed. So symptoms over time will exacerbate to about 24 million. It's about $11,000, per readmission for COPD. That's about 118% more expensive.
Yeah, and so when you say a readmission, that's someone who's been treated and the treatment didn't work, and so now they're back within what, a 30-day time horizon?
Yeah, essentially what's happened is they've been discharged for a disease. In this case, it's COPD. And within 30 days, they end up back in the hospital because whatever treatment they've been doing either wasn't appropriate for their needs, wasn't compliant for their needs, or some other reason that we look at as a failure of modern medicine. So yes, it's $11,000 average, but the median is probably higher than that. What you're looking at is, on top of those readmission numbers, Bradley, the federal government, for certain levels of readmissions, percentages. So I think the national average for COPD is something like 17% readmission, which is pretty high. If you don't get it below 11 to 10%, I think by the next year, CMS is going to reduce the reimbursement from Medicare to your particular system or health entity. There's a lot of complicated, I think, math and also algorithms involved in how they calculate that. The big story here is that the more people come into the hospital after a discharge for a chronic condition like COPD, the more risk to them and their health primarily, but secondarily, the larger risk to your health system and its financial stability, because the federal government will reimburse you less because they're penalizing you for not offering the right care the first time. Back to CMU, basically with Kim Holland and Joe Marks, through their stewardship and through my interest in voice-first technology and what I think Alexa's bringing to the digital experience and the healthcare experience, have developed with a partner of mine out of LA, who I'll leave unnamed. She's working with another entity at the moment. A tool where we can send patients home on discharge with an Echo Dot, and they have some customization. It's connected to their phone. They, like the pediatric patients in the burn unit at home, have access to instructionals about COPD. What is it? How do I take my meds? When do I take them? We've also added prompts to nudge them into making sure they're taking their meds appropriately, as well as tracking health data, prompting them to respond to the Echo and Alexa by telling Alexa how they feel. They give 3 levels: green being, I feel fine; yellow, I'm having some trouble here and I need some help; and red, which is 911, Alexa, stop, which is 911 and emergency services. The purpose of all of those being the patient themselves, when they're reporting, can get the help they need through the Echo Dot. Now that it allows phone calls, can be connected to a nurse or a provider, which can instruct them to take meds that they need on an emergency basis, clean equipment if it's necessary, or maybe they have something set up wrong. Alexa has protocols and cascades of questions that we programmed into it in order to reduce the amount of time a patient might spend in seeking care at the ER or, God forbid, having a readmission. More importantly than that, as a behavioral economist, you can take all those things together, and we can also drive incentives for this daily use. We can rank them amongst other people that have COPD. We can compare them to others by incentivizing good habits they have and showing them a percentage or telling them a percentage of odds that they have of not going back to the hospital, or that they're being rewarded for taking care of themselves well. We could also inform them if they're not responding to the Alexa, or they're responding that they're not compliant with medications as appropriate, that they can do a better job. And if they don't, they risk going back to the hospital or something worse.
So you've got a plan that you've put together that you pitched to the Alexa Fund people with Amazon, that they can get involved with it, and you were a part of their pitch day.
That's right, Bradley. I'm sorry. Yeah, so I was invited by Joe Marks after this creation at Kim Holland's health system to present what we're going to be providing the patients. And Amazon was very interested in hearing from us. So,
yeah, I bet they were. And let me, on the first show that we launched on Voice First FM, which is simply called the Alexa Podcast.
I listened to that. It was great.
Well, I appreciate that. So we talked about on that show some other news that's come out in the last week or so about Amazon's Echo Show and Echo Look. And I specifically want to ask you about the Echo Look first and get your opinion on this. So the Echo Look, if you haven't heard of it or know what it is a combination of the Alexa technology, the microphone and the voice interaction with a camera.
Oh, wow.
And the way it is presented by Amazon to the marketplace is that this is going to be a device that you put in your bedroom or near your bedroom that helps with your fashion sense. So it helps you select better looking clothes. And
I need all the help I can get, Bradley.
Yeah, I think we all do. So, but it's designed, at least it appears to be marketed primarily more toward women, at least at first. And what I find interesting about it, and on the Alexa podcast, I was recounting that my wife saw an advertisement on Amazon.com for the Echo Look and was asking me, "What is this?" And she thought it was very interesting, and her only concern about it was, does it actually work? She didn't voice any privacy concerns about having a camera in the bedroom
Bradley,
or in the closet or something.
Privacy is a whole other show we should do, but I will contend that most of the country's sense of privacy is definitely out the window, so that doesn't surprise me that she was not concerned about that.
Yeah. Well, I think you're right. It's a commentary unto itself, and I'm sure every episode of this show will probably cover privacy to some degree. But I wanted to ask, to me, this device, the Echo Look, has a lot of potential healthcare implications because it's taken at a minimum, it knows what you look like. And so that's healthcare data by itself. But tell me about what you think about how that strikes you and sort of where you see all this stuff going.
Well, there's, the Echo Look is a fascinating tool that Alexa and Amazon come out with. At the CMU conference at Carnegie Mellon, I was listening to a presentation in which they were using Alexa with a special kind of chromatography, I guess is what it's called. Let me see. Hang on one second, Bradley.
Sure.
Well, yeah, so there was a special kind of camera, let's just say that, on the Alexa that would be able to look upon all kinds of equipment and measure the vibration of it.
Okay.
And by measuring the micro vibrations in it, what they're able to do is they can inform you what's running in the house. The fridge, the sink disposal, the dishwasher, the clothes washer, all distinct vibrations. What's even more interesting, and with tools like Echo Look and this other tool that was presented at Carnegie Mellon, If you have a patient who's not feeling well, their color, the temperature that they have coming off of their skin, even their even their breathing rate can be measured using that tool, which sends all kinds of really important data back to healthcare professionals. Now, if that can be integrated properly into an EMR, and even more importantly, if you can take this out of the AWS Lambda tool and connect it with other vectors that are important for someone's health who has COPD or diabetes or CHF, even for swelling with CHF, for example, there can be alerts. There can be alerts that either are automatic or from actual person. This is a profound change in how healthcare can be delivered on a day-to-day basis. I mean, think about it. If you and I just go to the doctor twice a year or 4 times a year, we're missing about 5,000 hours of waking time I'm not being catered to by a physician. Now, reduce the amount of physicians that are available in the world and give yourself a chronic condition, and that ratio gets even worse. So having tools like this with Alexa, to me, is the harbinger of change. You're looking basically at a future where there are less big box hospitals, but there are big box areas with floors full of practitioners who are monitoring or speaking with patients in their homes or through their phones, using Alexa type products, dealing with their day to day and preventing any sort of catastrophic event.
Cool.
It's very cool.
So
I didn't realize that the Echo Look was already out in the market.
Oh, I don't know if it's out on the market. I just know it was being advertised. I'm not sure when it. I think what it is, it's invitation only. So I think Amazon is giving it to just a select few people, if I remember right. Let me ask you about Ionia.
Yeah,
Share with
sure.
us what Ionia is and what you're doing with it.
Well, Ionia is my consulting firm, but it's also a product firm. So basically, what we strive to do is make changes in healthcare delivery that matter, using behaviorally informed approaches instead of only spreadsheet-driven approaches. I've had some work in my past where it was just spreadsheet, and well, we were just gonna cut our way to prosperity. We're gonna get rid of overhead. We're gonna get rid of the expensive supplies. We're only gonna allow orthopedic surgeons to use certain implants for knees and hips, and we're only going to go with certain drugs for anesthesia, etc. That isn't sustainable over a long time. And I realized that working in healthcare. And as a behavioral economist, I wanted to create something that got beyond saving money, that got beyond cutting physical costs, and really promoted social engagement as the blockbuster drug of the century. And so I started Ionia, and I started with one client. And I never realized that I would take off the way I did, but I've been very fortunate to do so. I have 3 clients now, one in the Bay Area, one in Boston, one in Nashville. Might be adding another one in North Alabama soon. So our first goal together with Ionia is to engage with clients in order to create delivery protocols that really work closely with how we know the human body, the human mind, and human emotions optimize for best outcomes, period. And that does mean combining talent and combining effort with folks that do work on cutting costs and looking at metrics and spreadsheet-driven ideas. But what we're really after is a change in the delivery model to promote social engagement, to look at behavioral economic methodologies like comparisons and rankings and frequency and prospect theory in getting people to be influenced to take care of themselves and habituate change for better, whether it's a provider or a patient. That's our first goal. Our second goal is to create software products that are our own, that we can sell as subscription to really help reduce readmissions, length of stay, make the ease of use in the OR more apparent, or any other tool that we can provide on a mass basis to healthcare from an insurance perspective or a healthcare delivery perspective. Our COPD tool involves that. With Alexa. Our third vector is having health systems, insurers, or other healthcare entities come to us and say, look, we have a problem, but we'd like to solve it with less people because we just don't have them. Can you help us create something using Alexa or other tools and behavioral economics to affect change on a large scale system given the problem we brought to you? So it's really kind of a customized solution vector that we're offering. All three together, we all hope that we can affect a lot of change to a lot of people in simple but vivid and unique ways, allowing the patient and the provider to connect and engage in ways we'd never had the capability to do before.
Awesome. So thank you for sharing all of that, and thank you for sharing all of your experience and your perspective over this show. And I'm going to wrap this up by saying every month the two of us will host this show.
Yes, we will.
We will have on all sorts of guests in the healthcare sector. A lot of this show focused on Alexa, sort of out of necessity. It's got such a clear market leader position, but as Google catches up and starts to do some unique things, and as Apple rolls something out over the summer, we'll incorporate that as well as whatever.
Ionia, I'm really excited about all these major players delivering their voice-first technologies and seeing who's going to win that game. And I bet you, Bradley, some people are going to be better at certain facets than others. And I really look forward to talking to these experts as changes come out with you and vetting these for the general public to discuss.
Yeah, absolutely. And competition in the space will be good, and it'll be great to have Amazon and Apple, and Microsoft and Google and any number of small to medium sized companies all competing to create compelling voice first products and services. So all of it, as it comes out, will be evaluated here as it pertains to healthcare, and we're excited to have this show as part of Voice First FM.
Yeah, Bradley, we're going to learn a lot. I think we're going to be blown away a lot too, and I'm happy
Yeah,
to be
well,
on the ride with you.
I'm not part of the industry. I'm just sort of here, and I'm here to ask the dumb questions that nobody else will ask. So, and I'm totally comfortable with that. But Matt, thank you for sharing your time with us, and until next time.